Hey guys, it's Dr. Thornell from England Family Chiropractic, and one of the very common questions that new patients have, and sometimes delays them coming into our office, is they sit at home wondering if their back pain or neck pain is a bone, a muscle, or a nerve problem. And I want to let you know that very rarely is it any one of those things. If it were a strained muscle, chances are you would have to have done something and you feel a muscle strain as it happens, and then it gets sore the next day, and within a couple of days it goes away. That's a pretty rare occurrence. It takes some real effort to strain a muscle. A bone problem would be something like a fracture or a bone bruise. You know you did that. Is it a nerve problem? Well, good question. A nerve problem by itself doesn't just become a problem. There's no reason a nerve would become irritated. So what happens is it's generally a combination of those three things. And most of the time, inflammation is a big part of that, especially those situations where you don't think you really did anything. You woke up one day and your neck is stiff, your back hurts, and then it just gets worse from there. It's not any one of those bone, muscle, or nerve problems. It's all of those things together, and it's an inflammation problem. Inflammation can happen from sitting in a position too long, from having heat on an area that's prone to inflammation. Inflammation can be created from relatively minor circumstances, and if it festers, what happens is that inflammation irritates the nerve, which alone can cause pain. The nerve then tightens the muscles around the irritated nerve, which also can cause pain, and then the joints around those nerves where the spine is supposed to move properly loses the ability to move, which then creates more irritation, inflammation, nerve irritation, muscle tightness, and everything snowballs into this mess that most people walk into our office with. So if you're sitting at home and you're wondering, is this a bone, a muscle, or a nerve problem, realize that it's probably all of those things. And yes, you need to see the chiropractor to correct those, because what we do is restore the motion to the joints, allowing for that inflammation to leave that area, so the nerve is no longer irritated, the muscles can relax, and then you feel better, which is everybody's goal when they have a problem like that. So if you're sitting home wondering if you have a bone, muscle, or nerve problem, don't worry about which one it is. It's probably all three. Get into our office, have us check it out, see if we can help you and get you back on the road to good health and feeling good.